nachos.
As a dentist, we're here to help people. One of the most challenging things is when patients, something happens at home. They break a crown, they break a tooth, and how do they communicate that information to us? As a dentist of 19 years, too many times I've gotten some terrible cell phone pics, an interesting story that did not match up with what happened in the mouth. And I'm super proud to be here with key resource and sponsor, Dr. Terrence, sharing what DentRx and iView can do to get you on the same page. Thanks for being here, Dr. Terrence. We can't wait to hear about what DentRx does to help patients and dentists get on the same page.
Thanks for inviting me. I appreciate it.
Sure. Tell us a little bit about what this camera does and why you invented it. You've been a dentist for how many years? You've been a dentist for, Dr. Terrence?
Over 25.
Awesome. That's great. So many years out there, and you saw this problem. What was this problem and how does DentRx solve it?
So for the most part, there's always something missing between what the patient identifies as an emergency and what truly is an emergency. If you're placing an implant and the screw is loose, the patient will call you and say, the whole implant came out.
Yes.
Really
Happened to me.
And so what happens is for the dentist, it actually manages his appointment so that he can actually set an appointment for something that he actually needs to have done. So if it's a screw, then I can set the appointment with the prosthodontist who comes in on Friday and not back up the entire appointment.
Such a key part. It keeps our sanity. I mean, we've also had people who don't really know how to describe this. Half of my tooth is missing. Then when they come into your office, you can barely see it. And then on the other side, they say, oh, a little piece broke off. And meanwhile, all the tooth has gone above the gum and we should have brought them in earlier. So now I know patients, I know dentists, I know technology some. Is this technology easy for the patient to use at home?
It's very easy and it's very simplistic to use. I actually brought the device so you can see it. And then if you were thinking about it, this pairs with your iPhone. So it's very clear and you can use your iPhone or an Android device. It's very simple to download. You go to the App Store or the Google Play Store, download the device and you're up and running. When you're ready to talk to the doctor, you can go onto the EMR and it will actually take you through all of the steps that would normally happen within your own practice.
Cool.
What are you here for? Chief complaint. And then it uploads the picture. So when the patient comes on, I can have a real, true, honest conversation while I'm looking at the patient. If I need a referral, I can get up to 4 referrals on the portal. I can have an orthodontist, a periodontist, or a cardiologist, so whichever.
That's key too, because sometimes the best place for them to come is not even your office. It's time to, when they say I have some gum growing over this tooth in the back, I'm already saying they got a wisdom tooth problem. And maybe, do not, I'll use an old, I'm a monopoly. Do not pass go directly to the oral surgeon. So tell me, you talked about that EMR and the telemedicine part. So can you actually bill for like a limited oral exam, or when you do that part, tell us more about that. I'm interested to learn about the telemedicine part.
Absolutely. I thought that was pretty exciting. When you actually are on the EMR with the patient and the doctor is done, you press send and it actually will be reimbursed by the insurance carrier.
That's awesome.
Reimbursed up to $185 for every 15 minutes. That's something to think about.
Yeah. I mean, what you're doing here is right now, you've been a dentist for a while. I've been a dentist for a while. Chair time is precious. And it doesn't mean that we're fancy. It doesn't mean that we don't want to help people, but just getting patients into the chair, processing that during the pandemic is tough. So if they can be at their home and you can solve that problem, bill for some of your time along the way and help them, it's really magical. So it sounds like the technology is easy to use. Patients can purchase this camera or the office purchases it for them. I know my Dental Nachos audience will be excited to learn more. And I know my dentist people, Terrence, they love a deal. They're very into a deal, not on their crown preps. Those are magical work of art, but they love a deal. So you guys have a deal as an awesome key resource and sponsor. Tell us about that deal.
So what we're doing today is the first 20 doctors that actually sign up get 3 free months of the EMR.
Awesome.
Get a discount on this magical device.
Cool.
That you can actually resell it to the patient and actually make something happen for both you and the patient.
I think you should call it a magical stress reducing wand because it does do that for everybody involved. So use that if you guys like. Now, people just want to go find out more about you on your website. What's the best website to go to?
www.dentrx.net.
Awesome.
Tells you everything about us.
And they can reach out to you guys and learn about how to purchase the camera, how to use the camera, all those things like that.
Yes, absolutely.
Well, I've had the pleasure of meeting you in person. You're one of the kindest dentisting humans I know. I know you do a lot of implants like me, and you've created something. Not everybody thinks about the dentist stress, Terrence. So it's nice of you to do that. Not a lot of people think about our morale. And as someone who's handled emergency calls for years, this is going to help so many offices. And I really appreciate you sharing with us.